County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Show, living a longer and healthier life. February is American Heart Month, so we're going to talk cardiology tonight. I'm really excited about this program because we're going to start off with Dr. Jonathan Kahan, cardiologist, South Florida Heart Institute in Delray Beach. It's at Via Flora and Military Trail. You can't miss it. Beautiful Riverstone building there. Huge cardiology group, and then also on staff at Delray Medical Center. And then at 6:30, we have Rahul Aggarwal calling in. He's an interventional cardiologist with the Jupiter Cardiology Group, and he tells me he's a plumber of the heart. So we're going to be talking all things heart tonight on the show. And without further ado, I want to get right to it. Dr. Kahan, welcome back to the program. How are you doing tonight?
I'm good. Thank you so much for having me.
And thanks for coming aboard on this adventure of health. And one of the reasons I wanted to have you back on, obviously February is American Heart Month, but I know you have a new certification that you'd like to share with us. Is it cardiac CT scans? Tell us a little bit about how you became certified and what actually it can help with, I guess.
Thank you. So cardiac CT scan is sort of an emerging technology in the area of cardiology. It's being used a lot right now in our emergency rooms when patients come in with chest pain, instead of having them stay overnight, sometimes even 2 nights, just to get a nuclear scan to make sure everything's okay, we can actually do a cardiac CT scan much quicker right in the ER and send them home. Additionally, we're using it as a new screening tool, especially in women, and what it's been sort of showing is that it's actually the best predictor of coronary artery disease outcomes out of all of our screening tools, especially in women. If you remember, you know, most of these screening tools we have are from the 50s, where they only looked in the male population. So it's not really applicable to women, and now we're sort of having this new exciting technique to be able to screen women for coronary artery disease that we didn't have 10 years ago.
And that's a great point, because isn't one of the flags you kind of get with women is around the menopause age? I've heard cardiologists talk about that. Is that because of the changes, hormone changes in the body? Yep,
exactly. Hormonal changes in the body can lead to an increased risk for heart attacks and strokes, and we want to make sure that doesn't happen. We didn't really have an ability to screen before for these things, but I think now this new technology is sort of emerging to allow us to do these things.
So that cardiac CT scan is done at Delray Medical Center then?
Correct, done at Delray Medical Center. It's a quick outpatient test. The actual test itself is under 5 minutes, very low dose radiation as well compared to the other testing methods. So it's looking like a win all around.
And you get the whole picture of the heart, and then you study it and come back to the patient, I guess.
Correct.
Follow-up appointment?
Exactly. We get the whole picture. We see your arteries. We see how your heart's functioning. And, you know, we can come and follow up with you and hopefully prevent something bad from happening.
We're here with Dr. Jonathan Kahan, cardiologist at South Florida Heart Institute. And also, I got to mention, Tenet, Florida Cardiovascular Care. I see it there on your lab coat. Yep. And we're part of Tenet Florida Physician Services. as well. So you mentioned something, and I was talking to you in the green room beforehand because this term always gets me, nuclear cardiology. I know I asked you to explain it last time. I'll probably ask you to explain it every time I have you on this show. But what is it, and how does that work to help you as a cardiologist kind of see what's going on inside the heart?
Right. So we're nuclear doctors as well, and we're trained in nuclear medicine. And what we do is we perform stress tests on people, either chemical or having you run on a treadmill, and we inject nuclear tracer into your body. This gets into your heart, and we can basically see how well the blood flow is going to your heart. This is, real nuclear medicine. So, for example, when I was training in New York, we have to give our patients cards so that if they went under the tunnel into Manhattan, they would actually set off the nuclear threat detectors, and there would be police waiting on the other side without that card. So it's real nuclear material, but it really gives us a pretty accurate picture of the blood flow to the heart.
I didn't know that, and thanks for sharing that story. And I know, New York City's got great law enforcement,
yep.
And that's really something that you have to give a card to the patients up
absolutely,
there.
Absolutely.
But hey, at least they're tracking it, and that's great to hear. I mean, you don't always hear that every day. Now, you mentioned stress tests, and I've been to your offices. I think you're with 5 or 6 cardiologists, if I'm not wrong.
Correct. So we're 5 of us right now. We're hiring a 6th one in September.
Okay, wow.
Yeah.
Okay. And that's the South Florida Heart Institute, which I mentioned is a military trail via Flora. I got that right?
Via Delray.
Via Delray. I keep on getting it wrong. I'll give out the address here in a minute. But you mentioned stress tests. Now, your offices are on the top floor of that building. Isn't there your testing done right on site?
Correct.
On the bottom floor?
Correct. Testing's done right on site. We have echo and nuclear technology, so we can do all the stress testing right in-house. You don't have to go anywhere else.
Neat.
Yeah.
That's one stop. That's great to hear because getting around South Florida, especially this time of the year, can be pretty tough. I was up in Jupiter today, and I didn't know if I was going to make it back in time. Now, something I want to talk to you a little bit about also, and this is a term I've had the vascular surgeon, Dr. Ricotta, on the program recently, peripheral arterial disease, PAD. I've seen it on your areas of interest here on your website at Tenet, FloridaPhysicianServices.com, or easier, TFPSDocs.com, DOCS. Now, why is that one of your areas of interest as a cardiologist, and why is it so prevalent? Why is it so much in the news lately?
Right. I mean, peripheral artery disease is really a diagnosis that is missed a lot. I can't tell you how many patients I have come in and they say, oh, I can't walk, my legs hurt, I don't know why, and they're sent for a cardiac evaluation thinking it's their heart. But everything's connected, right? The leg veins, the leg arteries, they're all connected to the heart. And just like we can get disease in our heart arteries causing heart attacks and that sort of thing, we can get disease in our legs. A lot of my patients have trouble walking, and no one's even looked at the legs, which sounds funny, but it's true. We have great techniques for picking this up to make basically peripheral artery disease is blockages in your legs. And we have, ultrasound techniques to pick this up. I'm trained in vascular imaging as well. And we, can pick these up and really, really change people's lives. People who couldn't walk 50 feet are now able to walk for miles.
Oh, that's great to hear. And I've had a lot of physicians on this program, and it seems like we have the best of the best here in South Florida. So it's great to hear. And I know that you're very busy with it because I've seen you in the hospital hallway. Actually, I was telling listeners on Friday, I got to attend a surgery with Dr. Ricotta last week. It was the first of its kind in the world. Its press release is out and about. But long story short, when I was going to the hybrid OR opening, you had stopped me in the hallway and waved, and I thought that was really nice that you took the time. But also I ran into your colleague as well, Dr. Vafai, and and I know Dr. Lieberman, who kind of is the leader of your group, is always in the cardiac lab there as well. So not only at South Florida Heart Institute, but these are the main players in cardiology here in Delray Beach area, well, across southern Palm Beach County. And I imagine you have people come from all over the world as well to the office. Now, I'm going to go through a little bit of your areas of interest here, and if you could explain a couple of them, the ones we don't always talk about. Hypertension cardiomyopathy. Is that something that you treat?
Correct. So hypertrophic cardiomyopathy is the most common genetic cardiac condition in the world. Whenever we see young athletes unfortunately drop on the ground while playing sports, it's overwhelmingly because of that. It's a disease that we can treat. We have good treatments for it, and we actually have the ability to genetic test anyone in the family once we pick up that index case. Without treatment, the disease, as you've seen in the sports field, can be fatal. But with treatment, we can actually, we can have our patients live long and normal lives. So it's critical that, we come in for screening and, if anyone suspects that they may have this condition, or one of their parents was diagnosed with it, or even one of their brothers and sisters was diagnosed with it, to come in and get checked out. The screening is simple, cheap, and completely painless, and we can potentially save people's lives with it.
Most common in the world. Is that why there's defibrillators at all the baseball fields and basketball courts? Is that kind of the thinking?
Right, I mean, it's part of it. The defibrillator program has really sort of changed the way that we treat cardiac disease in mass events. It was actually started in the casinos because the casinos had cameras on everyone, so they were able to get to people very quickly. But now we know that defibrillators in airports and settings and really everywhere can save someone's life for a variety of reasons. And they're very simple to use, and training is pretty easy.
Okay. I didn't know that. It's the most common. So we're learning new things every day on the You and Your Doctor Living a Longer and Healthier Life. If you have any questions for Dr. Kahan, number's 1-888-565-1470. He'll be here till 6:30. Or we're on Facebook Live. We're on the All County Healthcare INC page. I see the viewers there. I can see the numbers. We got a nice number of viewers right now. So if you can type in the questions, if it's appropriate, I'll throw it in front of Dr. Kahan. If not, I'm going to give you info on where to find him and his phone number and website as well. You mentioned in the last talk, and this is kind of what, the viewers are going up. That's great to see. Technology, it's amazing. But you mentioned, I think you mentioned in the last comment something about a little bit about genetics. And one of the reasons I wanted to have you on the program is because you have, and correct me if I'm wrong, I don't know if this is a new interest or something that comes from your education, but you kind of have an interest in the molecular genetics of congenital heart disease, and that's a mouthful. But why is genetics so important in diagnosing and treating heart disease?
Sure, absolutely. So, in the past few years, we have a new technology that is really, starting to revolutionize medicine. It's called the CRISPR-Cas9 system, and basically what we're able to do for the first time is really edit our own genomes. The early human trials are starting. They've been doing it in animals for a while. But like I said, for example, hypertrophic cardiomyopathy is a genetic disease. And in the future, hopefully not too far, we'll be able to, instead of, treating around the symptoms, be able to actually just cure the disease with genetic components. Now, cardiology is an area that's, always fascinating, always changing. And I think the next level is going to be sort of testing, our genetics to see how we respond to different medications. For example, in high blood pressure, we basically use very simple factors to decide which blood pressure medication is right for you. And I know all of our viewers who have high blood pressure, which is 1 in 3 Americans, by the way, have titrated their medications up and down, switched medications and that sort of thing, because we don't know which medication responds to you. And hopefully in the near future, we'll be able to test you to see which medication will actually help you the most.
And I was trying to read a little bit about this and know what I was talking about tonight. But So you're building a map of the individual's genes.
Correct. We're already able to do that. We're able to build maps of different genotypes. That's the basic genetic makeup of an individual. We can compare that genetic makeup to databases of millions of people, and to see what's abnormal, what's normal, and what are the variations. Now, taken from that, once we know what the genes actually do, then we'll be able to, modify them to hopefully help a lot of people.
And I know most of your patient base right now is older, probably baby boomer or older.
Right.
But I think that is fantastic that you seem to be a step in the head of, what's coming next.
Right.
and in terms of molecular genetics of congenital heart disease. So, and if we have any millennials watching, I'm sure they'd be interested in that as well. So
Yes.
That's great. We're going to take a quick break, and on the other side, talk to Dr. Kahan a little bit about preventative cardiology on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated in Broward counties for the last 25 years. The practice of medicine, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, my name is Deanna Barron. I'm an RN with All County Health Care. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Health Care.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And that's right, that phone number works. Welcome to back to the You and Your Doctor Living a Longer and Healthier Life. I know we got a caller, so I want to bring him on with Dr. Kahan. Stu, how you doing? Welcome to the You and Your Doctor show.
I'm sorry, you broke up on me there.
Oh, Stu, how you doing? Welcome to the You and Your Doctor show, Living a Longer and Healthier Life. Do you have a question for Dr. Kahan?
I do. I was wondering, when it comes to the heart, what percentage of the people, the genetics of the people runs in the family? What's the potential for my family members if it runs in the family of having a heart attack or having the cardiovascular issues? That's
a great question, Stu. So it really depends on what what specific disease we're talking about. When we talk about things like hypertrophic cardiomyopathy, we are actually talking about a 1 in 500 chance of having that condition. That condition's also passed in a way that's called autosomal dominant, which means that it's passed to most of the family members. Now, when we talk about more, basic diseases like coronary artery disease and heart attacks, which I'm guessing that's why your question was, I would say that we haven't got it all figured out yet. There are definitely genes that make you susceptible to coronary artery disease, and you see it. You see it in the families. You see these strong family histories. Every male in the family had a heart attack before 50. Every female had a heart attack before 65. And these are risk factors that, while we don't really understand all the genetics right now, so I can't give you an exact percentage, these are definitely things that raise our that should raise red flags and should have you see a cardiologist even if you're feeling fine. Because what we can do is we can screen you then, like, for example, with the calcium score that we were talking about earlier with the coronary CT scan, and we can prevent bad things from happening.
Oh, that's good to know. Stu, did that answer your question? Do you have any other questions for Dr. Kahan?
No, that was good. Thank you very much.
One more thing. Where are you calling from?
from Boca Raton.
Nice. We're here on Boca. Well, thanks, Stu, for the call. And Dr. Kahan, you mentioned a little bit about preventive cardiology. There are things that maybe, the population can do. As a cardiologist, what kind of recommendations do you have to be heart healthy?
Sure. Thank you. So preventive cardiology is sort of an emerging field, and there are actually, starting to be a lot of interest and a lot of research in this field, because what we do believe is that almost 90% of cardiac issues are preventable with certain, lifestyle measures. The most important one, which I think everyone sort of knows at this point, is to obviously, cigarettes are bad for you, smoking's bad for you. I think the jury's still a little bit out on the electronic cigarettes and the vaping. It's still too early to tell how that's going to factor in, but at least we know that smoking's bad, and I think everyone sort of knows that at that point. One thing that might surprise our listeners is that even walking 150 minutes a week has been shown to improve mortality and morbidity outcomes. That's 150 minutes a week, not a day. So we're talking about 30 minutes a day. 30 minutes 5 times a day, 5 times a week is really minimal stuff. And the weather's beautiful outside right now, and it's time to get walking, get moving. Basically any exercise that you choose. The next thing I would do is talk about diet. There's a lot of controversy on diet. I have a lot of patients doing different diets. There's keto diet, palliative diet, but the ones that we sort of recommend and stick to are the Mediterranean diet and the DASH diet. What we're essentially looking for is high vegetables, high in fish, low in red meat, and low in saturated fat, and that's the one that sort of, over the studies has played out to be the best. And the thing I really want to impart upon people is it's never too late. Even if you're in your 80s, mid 80s, late 80s, 90s, it's still time to start eating right and to start, moving around. And these things really do have an impact on your life, and basically can prevent bad things from happening in the future. And we know this, and we've shown this in multiple studies.
Thank you. That's great to hear, and I'm going to take you up on getting outside more in this beautiful weather, because we live here, and I don't think we take advantage of it.
Definitely.
I don't, for sure. I'll tell you.
Definitely. I'm from Toronto. I trained in New York, and I can tell you that you guys, we have it so lucky down here that, the weather's beautiful, and, we can get out and move, and there's so much to do.
Well, we're glad to have you here in South Florida. I want to share a little bit about your education and certifications with the listeners. If you want to read a little bit more about Dr. Kahan, you can go to tfpsdocs.com. I said I was going to give out the address. There's a location button there. So it is 5035 Via Delray in Delray Beach. The number's 561-637-0500. Known as the South Florida Heart Institute, but it is part of Tenet Florida Physician Services, and the doctors there are on staff at Delray Medical Center, which is great heart hospital here right in our backyard. I don't always read the education and certifications, but you've kind of been around the world, so I have to do this. Dr. Kahan is certified by the American Board of Internal Medicine, National Board of Echocardiography, so he's an expert in that as well. That's one of his areas of interest. American Society of Nuclear Cardiology, he is certified with. I see here medical school, Sackler School of Medicine, New York, American Program of Tel Aviv and Tel Aviv, Israel.
Correct.
You studied in medical school in Tel Aviv.
I did. Most of my family's from Israel, and I had a great training. I was trained, directly by, even Nobel Prize winners. It was amazing. I highly recommend the school to anyone interested in going, and it was a great way to connect with New York, where I finished most of my training.
Nice, and I'm going to go right into that residency, St. Luke's Roosevelt Hospital at Columbia University, New York. That residency was in internal medicine at Columbia.
Mm-hmm.
Wow.
Yeah.
That is fantastic. And then fellowship, Winthrop University Hospital, Mineola, New York, general cardiology. You were the chief cardiology fellow there.
Correct. So I was the chief cardiology fellow there. That's actually part of NYU now.
Oh, okay.
Yeah.
And I definitely want to talk to NYU because I listened to Doctors Radio on Sirius XM radio.
Yeah.
And that's out of NYU Langone Center. Right. Same thing?
Same network now.
Same network.
Yeah.
Okay, I've seen lately they've had doctors outside of NYU on, so I'm definitely going to see if Freddie and I can talk to them, maybe see if they'll pick up this show as well, because I am an avid listener. I was listening to vascular surgery today and fascinated by it as well. Anything with health. 5 years ago, I was a newspaper reporter, so I've really changed paths, and I really enjoy it. It's a passion. So one thing I wanted to ask you about Israel, I didn't know this until I started studying recently. Israel is one of the worldwide leaders in health research.
Correct.
Health education. I did not know this. I'm from South Florida originally. I don't know why I didn't know that, but it really is.
Yeah, Israel and America work very closely with each other to develop a lot of, cutting-edge research. They have great hospitals there. And really, great training and great people. It's been really, pleasure to be there and be connected with that sort of thing.
That's great to hear, as well. Now, one other direction I wanted to take this into is we talked a little bit about preventative cardiology, and as a cardiology, you also in the hospital setting, I believe, do a procedure which can give you a little better understanding of what's actually going on before you have to make a decision of what needs to happen with the heart, and that's called transesophageal echocardiography.
Yeah, the name's a mouthful.
I messed up. I was practicing it. So
okay.
tell us, say it right.
So transesophageal echocardiography is a way where we get very close to the heart. We basically go through the mouth, down the throat, into the esophagus, and it's a little known fact that the esophagus and the heart actually touch each other, which is why we're able to get such good pictures. We can do lots of things from there. We can assess your valve, any valve issues very closely. We can actually do 3D imaging of the valves. We even provide therapeutics with that, atrial fibrillation, which is one of the most common arrhythmias in the world. We can actually treat using that technique to make sure you don't have any blood clots in your heart and then putting you back into normal rhythm. It's a very safe, very quick procedure. It takes about 10-15 minutes. Of course, you're under sedation for it, so you get the best sleep of your life at the same time.
Now, that's obviously done at Delray Medical Center in the hospital setting?
Correct. We do it all day, every day at Delray.
Okay, and primary care doctors can refer their patients to you for those kind of things?
Correct,
okay.
Absolutely. Primary care doctors. I'm also on ZocDoc.com for anyone who uses that. And even, if you have a cardiac issue, you can come see me and, we can figure it out together.
Yeah, and good point there. You can actually book appointments online with Dr. Kahan at tfpsdocs.com. Just type his name into the search bar there and it'll take you right to his page. On there's physician info, location in the news, all kinds of links there as well. And you mentioned heart arrhythmias. Yes. So atrial fibrillation is a heart arrhythmia then?
Correct. So atrial fibrillation is one of the most common heart arrhythmias. It's caused first by age, secondly by high blood pressure. And the problem with atrial fibrillation is that can lead to strokes, which can be devastating. And we can treat those very effectively with medications that control your heart rate, control your heart rhythm, and prevent you from having strokes and really, can save your life.
Okay, fantastic. We got about a minute left, and then I got Dr. Aggarwal calling in on time, which I love that. But thank you again for coming on time as well. I mean, I know this traffic is something else this time of the year, and you came from Delray Beach. But what are your hobbies and passions in life outside of medicine? It seems like you're pretty busy.
Pretty busy.
Family man?
Yeah, family man. My wife and 2 kids are listening.
Nice.
And they love the show. So I spend most of the time with them trying to teach my daughter how to ride a bike right now without training wheels. And I also play hockey for anyone who's interested.
Really?
There's roller hockey down in Sugar Sand Park. So,
You play roller hockey then?
Yeah.
You don't go on the ice anymore?
It's hard to find time.
Yeah, and you got to get dressed. And all that. I have a friend who plays hockey up in Lake Worth, and it's quite a production. I just go and watch. I want to try to be the goalie, but those days are over. So, yeah, definitely. But family man, and I'm not quite there. I got an 8-month-old daughter,
I know.
right behind you.
Yeah.
But I may ask you some questions in the future.
Definitely, I'm always available.
But thanks again for coming on the program. We wanted to have you. February is American Heart Month. And again, it's Dr. Jonathan Kahan. He's with South Florida Heart Institute in Delray Beach. The number there is 561-637-0500, or look them up on tfpsdocs.com. Thanks again.
Thank you so much.
You're always welcome on the program. On the other side, we got Dr. Rahul Aggarwal. He's a interventional cardiologist or plumber of the heart, going to talk to us a little bit about diabetes on the You and Your Doctor show. Thank you.
Thank you.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to the You and Your Doctor, Living a Longer and Healthier Life. February is American Heart Month, so I want to dedicate this whole show to the heart and the latest in heart care. So we just had Dr. Jonathan Kahan on, cardiologist with the South Florida Heart Institute in Delray Beach, and with Tenet Florida Physician Services, and also with Tenet Florida Physician Services with the Jupiter Cardiology Group. I'd like to welcome Dr. Rahul Aggarwal. Dr. Aggarwal, how are you doing tonight? Thank you for calling in.
I'm doing great, David. It's great to be on.
Thank you. I think I had you, I got to look back, I had you on the call in maybe a year and a half ago when I started this show, so it's great to have a doctor like yourself come back. And I always tell the listeners, you're always gracious with your time. We've had you on TV a couple times, and you never say no to me, and I really have, coming from a PR standpoint, I'm really happy about that. So thank you. Now, you told me that you're a plumber of the heart. Explain to us a little bit about what you do.
You know, medicine has gotten so complicated, and to kind of make it simple for some of my patients to really give them a better handle on all the level of subspecialties and all the organs, I basically use that terminology because I do interventional. I open up arteries with stents. And there's another field of cardiology, general cardiology, which I also practice. But I practice that. And then the third field is electrophysiology, which I call the electricians. So I kind of categorize it that way, and so patients get a much better handle on what's going on. Then they get it then. So we try to keep it simple.
I understood right away because the first thing I thought about was stents, and you're kind of the doctor who puts the stents in, maybe a balloon if it's needed, the catheter-based treatment of heart disease, correct?
Correct.
Nice.
Correct. Somebody comes in with a heart attack or angina, We do an angiogram. We find the blockage. We put a wire down the artery. And on that wire, we have, imagine a hollowed-out hot dog. That's, like through and through. That's the balloon. And the balloon rides on that wire, and then we inflate the balloon, and we squish the plaque. And then we do the same thing with the stent, which is basically this very, very sophisticated, looks like a pen spring, but much more sophisticated architecture, and it's crimped down to a balloon. And we ride that up on the wire, and we place that at the site of that lesion. We inflate the balloon, and that stent pushes up and opens up that artery. Yeah, it's all plumbing.
Fantastic. It's a great way of explaining it. I really get a vision of it. And I told the listeners I had a chance to observe a interventional heart procedure once, and I will tell you it's minimally invasive. This is going through, and Dr. Aggarwal can correct me if I'm wrong, this is going through a vein or artery in the leg, or maybe sometimes I think maybe in the wrist as well. This is not an open surgery. This is minimally invasive, correct?
That's right. When I was training in medical school, I actually was thinking about open heart surgery, and I had a couple of wise docs that said, you know what, if you really want to be on the cutting edge of it, of course this is the late '90s. They said, you really think about interventional cardiology, because that's where everything is moving. Everything is moving towards smaller incision, faster recovery. And so I heeded their advice, and I'm happy I did it. It really has been revolutionary in the field of cardiovascular medicine.
And we're glad you did, because you're very well respected in the area at the Jupiter Cardiology Group, and then also on staff at Palm Beach Gardens Medical Center. And after 2 years of these listeners listening to me, they know I was born there. So that is like my alma mater. I love that place. True story. 1977. I don't think any babies are born there nowadays. I don't think it's that type of hospital. It's more of it's known for, it's a heart hospital, right? That's what it's really known for.
That's right. And for, I think, almost 20 years, it was one of the busiest heart hospitals in the state of Florida. Matter of fact, the open heart program started in 1981 under Dr. Farrow, and it's been busy ever since. Now, of course, Florida has grown, programs have grown, so things have changed, but it's still a very busy heart hospital.
And then your practice is over in Abacoa, right? Jupiter Cardiology Group?
That's right. We're in the Abacoa area, and as busy as ever,
With Dr. Craig Vogel as well? He's the cardiologist in that practice?
Yes.
Nice.
Yes. So Dr. Vogel's been practicing probably 17, 18 years, and so I was fortunate enough to join the group about a little over 8 years ago. So,
wow.
It's been great.
Well, again, we're lucky to have you. Now, I was actually, you're going to remember this because you did this about a year ago. I was at the Jupiter Health Seminar today, and I know you presented to the town of Jupiter just about a year ago on a guide to cardiovascular disease in people with diabetes, because I found on your website at tfpsdocs.com there's a video of your presentation, which I found really, really amazing.
Oh, thank you. Yeah, that's the abridged version, and it's difficult to really dive into a complicated topic like this. And I distinctly remember that lecture, because after I was done with that little lecture, I had an engineer come up and talk to me, and he says, "I don't believe a word you said." And I'm like, "So explain, why that is? Well, why you believe that way?" And he says, "Well, I don't really truly understand the link between diabetes and heart disease." And that was a major piece that's very important, and this is something that's why I harp on with my patients, particularly those who are pre-diabetic and even diabetic, is the importance that diabetes plays in accelerating heart disease, oxidizing tissue, and eventually heart attacks and strokes. It's a huge, huge problem throughout the planet.
And yeah, in your presentation, I know we won't be able to get to all of it in just a short amount of time we're here tonight, but I know it starts with the three main types of diabetes, but what I wanted to ask you, Why is diabetes and nutrition such an interest to you as a cardiologist and interventional cardiologist? What are you looking for in that connection, or those two elements? How do they affect the heart?
Yeah. So the interest started really when I was in fellowship. I was fortunate to have a mentor, one of the cardiologists at Wake Forest. Name is Dr. Renato Santos, and he was big on nutrition, and he said, it's not just opening up the artery and restoring blood flow. There's a lot more going on here, and he was absolutely right. Trying to understand the biology, the mechanical component of receptors and oxidation and aging and all that plays a huge role. And so when one dives down that rabbit hole, you start learning more and more and more, and you realize it's so much more complicated than we ever thought. The idea that cholesterol was the end-all, be-all is now having to be revisited because 40, 50 years ago, we said that cholesterol was all you had to worry about. And if you drive your cholesterol down, you avoid cholesterol foods, you're going to do fine. And if you take cholesterol medications, well, what's interesting was that was only partly correct. But what we found was that it wasn't so much cholesterol, there were different layers of cholesterol. And that was in the 1980s. And once you dove into that science, then you realized, well, it's not just the different types of cholesterol, it's what you do with your cholesterol. We have patients with very low cholesterol who still end up getting bypasses, and I have patients with high cholesterol who don't get anything happen to them, and I have every combination in between, which was one of the observations that I and many cardiologists have seen, that there's more to this than we really understand, and we're still learning more each day. And so one piece of that was, where does food come into it? And as I kept studying, seeing what are the others saying, what are other doctors saying, what are other literature saying, you start realizing that food and nutrition is really a major, major piece of human health. And that, basically real food really is medicine. Real food is medicine. And one of the major problems that we have of modern society and modern foods is that we eat a lot of carbs, and a lot of, frankly, crappy carbs. There's different types of carbohydrates: simple, complex, high fiber, low fiber, high glycemic, low glycemic. This is a huge, huge topic. But one of the elements of it is that as we become diabetic and our blood sugar levels start to rise, that blood sugar acts like an oxidizing agent. And so what happens is it starts to oxidize the cholesterol. It starts to oxidize the arteries. So our arteries get harder. Our cholesterol gets oxidized there, and then you start developing plaque. And this comes into play. So it comes down to the idea of, I got to make sure I don't become diabetic. And so that's something, a reason why I harp on this with my patients. I have patients who come in because they already have heart conditions, and I'm meeting them for the first time in the emergency room having a heart attack. And I have others who come in because they want to be proactive. And they ask, Doc, what is it going to take for me to not have to see you in the cath lab? And so this is a major, major piece.
Now, where Dr. Kahan earlier had a little bit of an older population, are you seeing in your practice, do you see a little bit of a younger population than maybe baby boomers and up, or is it mostly in that Jupiter area that you see baby boomers and up?
I see all. I mean, we see all adults.
Okay.
We have obviously a very large baby boomer population. Yes, we do have quite a bit.
I shouldn't have just said Jupiter, because I know you're on staff at a hospital in Palm Beach Gardens, so that community as well. One of the points I jotted down when you said that is interconnected, and how, once you have diabetes, it's kind of like, I hate to say it, but it's like everything's interconnected. It can kind of be downhill if it's not managed properly. So I did jot that down as well. And another, I'm gonna call it the quote of the night on the show: real food is medicine. That's fantastic. It really is.
And you know what? And that those statements like that date back 2,000-3,000 years. And it still holds true today.
And since you mentioned your fellowship, I was just going to run through and let everyone know where you were trained and educated at. Fellowship, again, Wake Forest University School of Medicine, Winston-Salem, North Carolina. Dr. Aggarwal did a interventional cardiology fellowship where he was the chief cardiology fellow. And then trickling inverted pyramid backwards from that residency. You guys and gals are gonna love this. University of Florida College of Medicine, Gainesville, Florida, internal medicine chief resident. Internship, University of Florida College of Medicine, Gainesville, Florida, internal medicine, and medical school at the University of Florida College of Medicine, Gainesville, Florida. I think it's safe to say we have a top heart doctor who's a Gator on the show tonight. That's awesome.
Yeah, thank you. Yeah, it was a lot of fun, a lot of good memories.
And Wake Forest, that's a very prestigious school as well. I mean, I had a friend go there and did very well in his career, and it's really, I know it's known as a very, a top-notch school as well. And you did a fellowship there in interventional cardiology. You were kind of, like you said before, you were kind of the futuristic doctor at that point 8 years ago in interventional cardiology fellowship, huh?
Well, sure. I mean, fortunately, interventional cardiology has developed rapidly over the last 30 years. Angioplasty was invented in 1977, and it really took off in the early 80s. Stents started to come out in 1995, and then the next generation came out in 2003. Those are the medicated stents. So, I'm just along for the ride. I'm just, we stand on the shoulders of a lot of great doctors before us who have helped develop it and move the science on.
And yourself as well. I'm going to go ahead and say it. I mean, because you're carrying on the legacy and taking it to another level for the practitioners of tomorrow as well. I have a couple more questions. We have a few more minutes. I kind of blew through the commercial break because I wanted to keep you on. I think we can just go ahead and go. I'm going to ask you to tell the mammoth story, so keep that in your mind in a second. But first, will you do it tonight?
Sure.
Okay, let me ask you a question before that, though, because I have them in order here. Is insulin resistance a worldwide epidemic? I think you said that in your video, right?
It is. We see it huge. The next generation of diabetics is all coming into Asia, and I still remember this SNL skit, where they're talking about how all the iPhones are made over in Asia and they come over here, and in the United States, our biggest export is diabetes. And obviously it was made in fun, but obviously it's tongue in cheek because we have made a major influence to the rest of the world, and processed foods and convenient foods have had a huge impact on us. And I tell patients, I say, we have paid a huge price for convenient food. When in human history could you drive up to a window, stick some money out the window, and they'll take your money, and in about 30 seconds, they'll replace it with a burger and fries and a big whopping soft drink, and you're on your way. It's very fast, and it's very convenient, and there is a biological price to be paid. And so insulin resistance is an epidemic. And, we as human beings have not seen this level of carbohydrates in our diets ever. I mean, for example, in 1990, and just in the United States, we had 6 million people diabetic at the beginning of 1990. And by the beginning of 2000, we had 24 million diabetics, and that has since doubled, since then. So we're having to ask ourselves, wait a minute, if we're supposed to be so healthy and we have all these medications and we have all these procedures, then why is the rate of diabetes going up almost exponential? And that's why that's why when one has to take a step back and say, okay, what are we doing right and what are we doing wrong? And the food was a major piece of it. And part of the problem was, for decades in the U.S. and in other areas, we told everybody avoid fat, avoid all fat, and that hasn't really panned out very well, because when you avoid all fat, you're left with carbohydrates and protein. And one of the problems with having a very low fat diet, and obviously there's a lot of details that I'm skipping here, but in an ultra low fat diet, high carbohydrate diet, particularly processed carbohydrates, you get insulin resistance, because what happens is you're introducing carbohydrates to these cells, and you're telling these cells, well, we're burning glucose, and you're going to burn it. And what happens is the insulin gets pumped out of the pancreas, and it's telling these cells you're going to absorb the glucose and you're going to burn the glucose. Well, after a while, the cells start to push back and say, you know what, I don't want to keep burning glucose, and they start taking away receptors to try to stop listening to insulin, and the insulin. You have to start producing more insulin over time. So this doesn't happen overnight. None of this happens overnight, And I'm talking specifically about type 2 diabetes. Type 1 diabetics are those who are children and they're born with it, or early on they develop a destruction of the pancreatic cells that produce insulin. So that's a different phenomenon. But type 2 diabetes is basically largely a preventable disorder that has run rampant throughout the planet. And so now we're starting to say, okay, wait a minute, if we're eating so many carbs and we're causing insulin resistance, so the opposite must be probably true. You have to drive the carbohydrates down to either prevent diabetes or potentially reverse diabetes. And so, yeah, it's an issue.
And we're here with Dr. Rahul Aggarwal, interventional cardiologist with the Jupiter Cardiology Group, part of Tenet Florida Physician Services, on staff at Palm Beach Gardens Medical Center right here in Palm Beach County. And I'm not sure that you can find a better explanation about insulin resistance anywhere from interventional cardiologist on the radio than the You and Your Doctor show. So I'm really proud to say that, because we're bringing the top doctors to talk about the heart. And February is American Heart Month. I got to ask you, Dr. Aggarwal, I know it goes right into it, if we have time, the mammoth story, and I know I want to get to the sodium circuit and the red light, yellow light, green light, but if you could tell the mammoth story, that'd be great.
Sure. So I called it the mammoth story, and I've lectured on it over time. And, imagine 5,000 years ago, 10,000 years ago, 20,000 years ago, our ancestors, many who are tribal, not everybody, but many of our ancestors were tribal, and they're hunting for a mammoth, and several of the hunters, they tell the tribe, okay, wait here, we're going to go get you a mammoth. So they track the mammoth, find the mammoth, fight the mammoth, but the mammoth gets away. Now they're going back to the tribe. Sorry, folks, mammoth got away. So now everybody's scrambling. Well, what are they doing? They're digging in the ground. They're eating root vegetables, bugs, squirrels, leaves, and just trying to get through the day and the weeks and the month. And the body says, okay, wait a minute, you spiked your carbohydrate intake, which means I know evolutionarily you missed the mammoth, which means now you have to walk another 50 miles before you find another mammoth herd. And so what that's doing is by spiking insulin, you're slowing down the metabolism. You're telling your body to store fat. And as a part of that, this is the sodium circuit. There's a sodium circuit, which we only understood by the mid-2000s, that in the presence of insulin and carbohydrates, aldosterone, renin, all these circuits start causing you to hoard sodium and hoard water. So you become more camel-like. And so by hoarding fat, hoarding water, and hoarding sodium, you're more likely to survive that 40-mile or 50-mile walk without any resources. So that was a survival advantage we had thousands and thousands of years ago. The problem is that survival advantage back then is now is a disadvantage today, because we live in a world of plethora. We have too much food. We're not having to go out and hunt for mammoths. We're not having to go out and starve ourselves for for several days on end, hoping what we're going to eat. Today, you just go in the fridge, you go to the Walmart Supercenter, you go to everywhere, and we have so much food. And so that gene that was selected out, that series of genes has now become a detriment for us. So once you understand the mammoth story and you kind of get it, you're like, oh, by spiking my carbs, I'm actually gaining weight, hoarding water, I get swollen, my blood pressure goes up. I have to stop doing that. And so that's when things become a lot more clear.
Dr. Aggarwal, you have a unique ability to help people understand things with the plumber of the heart and the mammoth story. So I think that is obviously you're a great interventional cardiologist, heart doctor, but I think that's got to be one of your great traits as well. And we're around a minute left. I'm going to use the time to tell everyone, go to tfbsdocs.com, put in Dr. Aggarwal's name, Rahul Aggarwal, Aggarwal, and take the time and watch that video on his site. It's called A Guide to Cardiovascular Disease in People with Diabetes. It's a fascinating video. Dr. Aggarwal's number is 561-627-3130. Thank you again for coming on the program, Dr. A.
Oh, my pleasure, David. Anytime.
You're always welcome. That's Dr. Rahul Aggarwal, interventional cardiologist on the You and Your Doctor Living a Longer and Healthier Life show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions